Induction during metabolism. Enzyme inducer, enzyme inhibitor, is the most important factor influence drug metabolism. Enzyme induction. Some of the chemically dissimilar P450 substrate drugs, on repeated administration, induce P450 expression by enhancing the rate of its synthesis or reducing its rate of degradation. We call it enzyme inducer. Induction results in accelerated substrate metabolism and usually in decrease in the pharmacologic action of the inducer and also of co-administered drugs. Look at this graph. Is phenobarbital and warfarin interaction. Phenobarbital is a selective hypnotic agent. It could be used in insomnia. Warfarin is anticoagulant. Look at this graph. The abscissa is time, the union is day. The ordinate is warfarin concentration or prothrombin time. The solid dot is concentration of warfarin. The empty dot is prothrombin time or warfarin effect. When concentration of warfarin is high, the prothrombin time is high. When the concentration of warfarin is low, the prothrombin time is low. The black bar is the time when phenobarbital was used repeatedly. Before using phenobarbital, the concentration of warfarin is here. When using phenobarbital repeatedly for a period of time, the concentration of warfarin decreases, and so is prothrombin time. When stop using phenobarbital, the concentration of warfarin recovers, and so is effect. When using phenobarbital repeatedly again, the concentration and effect of warfarin decrease again. So, the phenobarbital is enzyme inducer. Phenobarbital induces P450 expression or decrease its degradation. So, it could accelerate itself and other substrates metabolized in liver, for example, warfarin. It causes the concentration of warfarin and its effect decrease. So, if the drug is used together with enzyme inducer, you should notice about the drug interaction. Tolerance. It must also be noted that an inducer may enhance not only the metabolism of some drugs, but also its own metabolism. Thus, continual use of some drugs may result in pharmacokinetic type of tolerance, progressively reduce therapeutic activeness due to enhancement of their own metabolism. For example, phenobarbital. 1 tablet is used for a period of time. 2 tablets had to be used to maintain the same effect. Enzyme inhibition. Certain drug substrates inhibit cytochrome P450 enzyme activity. We call it enzyme inhibitor. Imidazole-containing drugs such as cimetidine and ketoconazole bind tightly to P450 heme iron and effectively reduce the metabolism of endogenous substrate, for example testosterone or other co-administered drugs through competitive inhibition. Ketoconazole is anti-fungal agent. Cimetidine could be treat peptic ulcer disease. If you are interested, you could check your textbook. Here is imidazole group. Look at this graph. Is chloromazidine interaction with phenytoin and tolbutamide. Chloromazidine is antibiotic. Tolbutamide is hypoglycemic agent. Phenytoin is anti-seizure agent. Look at this graph. The abscissa is time, the union is day. The ordinate is the concentration of tolbutamide or the concentration of phenytoin. The bar is the time when the drug was used repeatedly. When phenytoin was used alone, the concentration was here. When using chloromazidine together for a period of time, the concentration of phenytoin began to increase and cause toxic effect. If phenytoin is overdosed, there will be a lot of toxic effect. When tolbutamide used alone, the concentration is here. When using chloromazidine together for a period of time, the concentration of tolbutamide began to increase and cause more stronger hypoglycemic effect, which will turn into side effect. Chloromazidine is enzyme inhibitor. It inhibits the P450 enzyme activity and slows the metabolism of the cell and other substrates. Toxic effect. Enzyme inhibitor may open plasma drug level and lead to toxic effect from drug with narrow therapeutic indices. Look at this table. It's a partial list of the drug that enhance drug metabolism in humans. Here is inducer, and here is drug whose metabolism is enhanced, and here is the most common inducer we meet: carbamazepine, phenobarbital and other barbiturates, phenytoin, 瑞放片. To get this table, it's partial list of drugs that inhibit drug metabolism in human. Here is inhibitor, and here is drug whose metabolism is inhibited. The most common inhibitor we meet is cimetidine, cortisone. When drug is used together with enzyme inducer or inhibitor, we should notice drug interaction. At least you should keep in mind one enzyme inducer or inhibitor. Multiple choice. Let's look back the beginning case. Now it's easy. A woman taking hormonal contraceptive began to take phenobarbital for a period of time for some reason. Then his contraception failed. Which statement is correct as follows? A. Drug interaction. B. Phenobarbital is inducer of cytochrome P450. C. Phenobarbital is inhibitor of metabolizing enzyme. D. Adjust the dose of contraceptive. E. Stop using phenobarbital. The answer is A, B, D, E. 2. When digitoxin, which is metabolized in liver, is used together with phenobarbital, what will be happen? A. The concentration of digitoxin will be increased. B. Concentration of digitoxin will be decreased. C. Digitoxin effect will be increased. D. Digitoxin effect will be decreased. E. Digitoxin can cause toxic effect. The answer is B, D, because phenobarbital is enzyme inducer. 3. When the diazepam, which is metabolized in liver, is used together with cimetidine, what will be happen? A. Concentration of the diazepam will be increased. B. Concentration of the diazepam will be decreased. C. The diazepam effect will be increased. D. The diazepam effect will be decreased. E. The diazepam may cause toxic effect. The answer is A, C, E, because cimetidine is an inhibitor of enzyme.